Hi, I'm going to show you how to use the CranioCradle and the Sacrowedgy. These are tools that we have recommended our patients to use it. This is for the neck pain and this is for usually for sciatica pain that we recommend. So I'm going to show you this CranioCradle, how to place it properly. So if you have bought the CranioCradle, actually it tells you that there are many positions that you can use it on. But in my experience, I recommend only one that is a resting position. So the knobs go at the base of your head. Okay, so I'm gonna just put it at the base of the head and you're just gonna, and the triangular portion is on the top. So if you look at it, the triangular, the angle, it's like that. So knobs at the base of the head and at the triangle is at the top of your head. This is a great tool to have when you have cervicogenic headaches, and because it actually opens up it gives in more space between the C1 and the occiput and C1 and C2, and thereby reducing that headaches that arise from the neck pain. So I tell our patients, typically, I don't know what you say, but I would always recommend start with 5 minutes twice a day and then gradually build it up to 15 minutes. I do not want you guys to sleep with it because that's not a good tool to sleep. So if you're using it at night, make sure you put a timer on your phone so that in case you go to sleep, it will wake you up in 15 minutes to take it off. Okay? So this is the CranioCradle. Now I really like Sacrowedgy. This comes in two parts. The pink one is for female, and I'm looking for the blue one. And the blue one is for male, because the male and the female pelvises are very different. One is long and lean, and the other one is fat and short. So guess whose is pink? Ours. So I would use this lift only if you need it. If you don't need it, just stick with just this. She's not going to need it. So I'm going to lift it up. First, what you're going to do is you're going to, the coccyx, which is the tailbone. The tailbone is the last bone on your sacrum, like all the way to the end. So this coccyx fits in this groove. So basically the tailbone does not touch this at all. If your tailbone is touching something, you don't have it in the right placement. Most of the time, patients think that their tailbone should touch something, so they move it up and their tailbone touches this, and this is wrong because you will have pain after you do this. So don't do that. So bring the tailbone right about here, and this much portion is out. So if I look from here, I should be able to see this portion. Okay, so lift your bottom up, and I'm going to find her tailbone, or you will have to do it on your own. Her tailbone is right there, and I'm going to place this that depression where the tailbone will come. So go ahead and lay down. Is it in the middle of your pelvis? So one of the things that I cannot tell as a therapist if it is in the middle, only the patient can tell. Because if it's not in the middle, it's going to hit the SI joint on either side, and I don't want it hitting the SI joint. So when you do that, I'm going to show it to you on the skeleton just so that I emphasize how important it is to do this correctly. So this is a male. So this is how, so if you are laying on it, your tailbone is resting in that opening over here, this curvature, and this is outside of the tailbone. So if you put it correctly, you're going to notice that it fits properly. This is the L5 and sacrum, so it's not touching the L5 S1 junction, and it is not touching the SI joints on either side. So you don't, if you put it a little bit over here or a little bit over there, you're going to hit the SI joint, and that's going to cause pain. Or if you don't follow the rule about the tailbone in this depressed area, then you're going to hit the L5, and which is not what you want to do. And the one way of knowing that you have put the sacrowedgy correctly is if you have a sciatica pain, is that pain in your leg will go away or it will start to reduce. If the pain does not reduce, or if it gets worse, take it off and readjust it because you have not done it correctly. Another pointer that I tell all my sciatica patients is that before you lay on the sacrowedgy, make sure your pelvis is aligned. If your pelvis is not aligned and you're laying on the sacrowedgy, then you're laying on like a crooked pelvis, and it does sometimes work, sometimes doesn't work. Many a times it doesn't work. So there is a pelvic alignment video somewhere in our website. Look that up, do the pelvic alignment, and then do the sacrowedgy. And lay on the sacrowedgy. Again, you have to build it up to 20 minutes. So you have to lay on it for 10 minutes to begin with to see how you're doing, and then gradually build it up to 20 minutes. Very important. If you're laying on the sacrowedgy and the pain in your leg worsens, which means that it is not in the correct place, you have to adjust it, or please give us a call and we'll guide you through the whole process of how to lay on it correctly or how to align your pelvis correctly. Okay? All right. So 20 minutes on the sacrowedgy. Thank you.